The issue of mortality and our children, we don't have a shortcut.
Stakeholders in Kigezi Subregion have come together in a regional dialogue hosted by the local Sustainable Communities Organization Limited, LOSCO, in Kabale district. The discussion focused on two critical issues: the alarming rate of maternal death and the growing moral decay among the younger generation. The theme of the dialogue was increased capacity and access to sexual reproductive health and maternal health in Kigezi as a region.
Yeah, it is important to have this dialogue because, first of all, we are talking about maternal health. Maternal health involves childbirth, it involves pregnant mothers and the life of mothers carrying children in their wombs. So it's important to have this dialogue because as far as stakeholders are involved, as far as stakeholders are concerned that we are having today here, everyone has a role to play. Everyone can do something that can at least prevent a life.
Dr. Abudon Birungi, the chairperson of District Health Officers in Kigezi Subregion, shared a troubling statistic. In 2020, over 287,000 women and young girls lost their lives due to pregnancy-related complications. These cases of maternal death were caused by factors such as excessive bleeding, hypertension during pregnancy, malaria, and post-abortion complications, among others.
Turareba ngu mu Uganda on average ku mwaka gw'2020 abakazi baleka emitwalo 28 kashanju bakafuka bali kuzaala ningashi bali abweshonga zikwatira enenda konka turareba ngu hatiya abakazi barafuka bali kuzaala enamba yakyendere ku rugali 336 buli bakazi omutwali 10 barazaala kwisa abakazi 186 hari buli bakazi 100 emitwali 10 barazaala konka still ejo enamba mpango y'abakazi barafuka barazaala.
Dr. Abudon stressed the importance of prevention, urging individuals to abstain from unwanted pregnancies. For those already pregnant, seeking proper maternal health care services was emphasized as a critical step in reducing maternal mortality.
In the first place, for you to avoid the deaths during pregnancy, you start with avoiding pregnancy itself. So, avoiding pregnancy starts right away from when a child, giving them the right information, how they are supposed to abstain until the right time. And when they cannot abstain, when they are engaging in sexual activities, then they should be told to engage in safe sex where we have contraception. And also, when they have engaged in those safe sex, the next level of prevention is to encourage them to come to health facilities whenever they get pregnant. They do antenatal care services at least 6 times.
Various stakeholders in attendance expressed the significance of such dialogues. They highlighted the need to address maternal health and viewed it as a collective responsibility to save lives.
In the Kigezi region, it's a region which has a very difficult terrain. So we've seen because of poor roads, because of lack of transport, most mothers die while giving birth because they have not been rushed to get access to different health centers or hospitals. Then on the issue of children being very sexually active and engaging themselves in those sexual activities at an early age, it has also factors that is leading to this. One of the factors is that the children of these days access different gadgets where they get information from.
Region Police Commander of Kigezi Subregion, Ibrahim Theiga, committed to supporting the dissemination of information on maternal health and emphasized the power of shared knowledge. Seiga also stressed the role of parents in educating their children on right and wrong, addressing the issue of moral decay in the younger generation.
It's the reason of the parents. But we don't boldly tell our children that you see you can only do this when you have reached this level. But we train them to say, you see, when the body is active, so if the body is active, so what? We know very well the body is active. So if it is active, so you indulge yourself in sex because the body is active. So we don't strongly tell people to desist from such acts. We instead encourage them. Information is power, but it's only power when it's used rightly. Information is only information if it has gone to the deserving ones.
The alarming statistics reveal the urgency of addressing maternal health in Kigezi Subregion. Globally, every day in 2020, nearly 800 women died from preventable pregnancy and childbirth-related causes, highlighting the need for action. The Sustainable Development Goal (SDG) targets 3.1 calls for reducing maternal mortality to fewer than 70 maternal deaths per 100,000 live births by 2030. The dialogue in Kabale serves as a vital step towards achieving this goal and combating the mold decay affecting the region's youth. It is a call to action for all stakeholders, from health professionals to law enforcement, to come together to protect the lives of mothers and ensure a brighter future for the young generation in Kigezi Subregion. A story by John and Amara, Robert Ngamachi for Kigezi TV.